This video is a training program for degenerative disc disease. I'm going to show you stretches and exercises to reduce your spine compression and improve your overall strength. If you have degenerative disc disease, this training program is going to help you. But to get the best results, you first have to complete a functional diagnosis to customize the plan to your needs. All back pain has a cause, and if your doctor can't help you, then find a physician who can by going to backfitpro.com to get a functional diagnosis. I was diagnosed with degenerative disc disease 10 years ago when I was 21 years old. The doctor told me it would only get worse with age, and to make it better, I should avoid anything that loads my spine, like running, jumping, or lifting weights. While it sounds terrifying, degenerative disc disease just means that there's a little bit less fluid in your discs. Saying someone has degenerative disc disease is like saying an old person with wrinkles has degenerative face disease. It's descriptive, but it's not helpful at all. I'm now completely pain-free. I run, jump, and lift weights all the time, and in this video, I'm gonna show you how I did it. Your individual case is different from mine, and what has worked for me and my clients might not work for you. But what if it did? The first step is to identify postures that provide relief. For example, someone who is flexion intolerant, where bending forward causes pain, will likely find relief by lying on their stomach. So this is an excellent position for anyone who is flexion intolerant. If this is painful for you, you can even come lower. If this is still uncomfortable for you, I would want you to think about squeezing your butt or pushing your hips into the ground. In contrast, someone who is extension intolerant, where bending backwards causes pain, will likely find more relief in a child's pose. If tight hips are causing you pain, then lying with your feet up the wall might feel great. If lying on one side is painful, consider lying on the other side to find relief. Think about lengthening both sides. Also, think about extending your hips forward. So if your hips are behind you like this, you're not going to get as much of a stretch. So think about extending your hips forward and then reaching tall with your head and breathing deep. Awareness of how posture affects your pain teaches you what to do when your back hurts, which puts you in control. Treat Your Own Back by Dr. Robin McKenzie is a great book that goes into further detail on how posture can affect your pain. Stretch the areas that need mobility, like the hips and thoracic spine, before focusing on areas that require more stability, like the low back. Here are stretches that can help degenerative disc disease. Distraction stretches can provide relief for some people by temporarily lengthening the spine. You do this by putting weight into your hands to provide a vertical stretch to your spine. The couch stretch will loosen the hip flexor muscles. 2 minutes in the morning and 2 minutes at night on each side is a great place to start. If the hip flexor muscles are really tight, consider foam rolling first to identify and loosen trigger points in the muscle. So we start closer to the hip and then we move farther away. And I'm going to roll slightly to the side. So it's like I'm foam rolling the front corner of my hip. The TFL, tensor fascia lata muscle. For the quadriceps, I'm just gonna go up and down. You can start with both legs if you want. All the way up, be careful not to roll anything too sensitive, and down. To stretch your upper body, perform a prayer stretch or hang from a bar. The pigeon stretch will loosen up the outer thighs, while the frog stretch will loosen up the inner thighs. If your hamstrings are tight, learn how to roll your hips forward while sitting and while bending forward. Performing a hip hinge with good technique is the best hamstring stretch you can do. Sedentary living causes certain muscles to become short and tight, while other muscles become long and weak. Certain muscles need to be stretched, while others need to be strengthened. If you go to the gym and you strengthen muscles that are already tight, you're going to make your situation worse. Start the resistance training with core stability by performing the dead bug, side plank, plank with a leg raise, and glute bridge. Next, perform the ATG split squat to strengthen your hip flexors in a lengthened position. Superset this with a prone Y press to strengthen the muscles just above your lower back. Next, perform a hip thrust to strengthen your glutes, and superset this with a TRX row to strengthen your back. Next, perform a box step down to strengthen your legs while improving your balance and your hip hinge, and superset this with a suitcase carry to strengthen your core and improve your carrying ability. If you find that these exercises are a bit too challenging, in the description below, I've included a link to a blog post where there are exercises that are a bit easier so that you can train at any level. All of these exercises should be pain-free, and you should be able to breathe normally throughout the duration of the exercise. If you feel pain, stop and adjust or seek professional help. Start by performing the stretching and core stability daily, and perform the strengthening exercises every other day. If you notice that you're really sore or you're not recovering, then train a little bit less. And that's the Degenerative Disc Disease training program. What do you think? What are your comments? What are your thoughts? Give me your feedback down below. Leave a comment or send me a message. What would you like to see next? Until next time, peace.